We'll take time a little bit for questions. I think all of you guys, it's great to look at the data, and it's kind of like the national deficit. It's going the direction we don't want it to go. So any questions for these four speakers? Get your hands up, and we'll get a mic to you. One thing I think of a lot, I guess, Dr. Hilton, you looked at some of the data from 1994, just thinking about how the industry has changed from 94, maybe consolidation of producers. And I guess I lean more towards the clinical side than the epidemiological side. Just comment a little bit, all of you guys, what impact animal husbandry or animal husbandmen, are we losing that? Is comment on that.
So I guess what I would like to see from that data is what percentage of cattle were fed on the farm or ranch of origin in 1994 versus 2014. I mean, I practiced in Iowa, and growing up in Indiana and coming to Iowa, all the feedlot people that we worked with wanted to tell me about the glory days of feeding in Iowa, when Clinton County, Iowa was the prime beef capital of the world, and Iowa fed more cattle than anyone else, and those cattle came from the next door neighbor, et cetera. So I'd without giving you the answer, I'd like to see the data that says, was that a major change, at that time?
Sure, and I think even with that, I mean, and I'm kind of in east central Nebraska, the farmer feeders in my part of the world are 2,000 to 6,000 head now, and maybe even not so much farmer feeder versus corporate yard versus amount of employees per 1,000 head of cattle. My bias would be that we have a lot more cattle per person to manage.
Yeah, I would sure agree.
On the dairy side, the large dairies have traditionally relied on Hispanic labor from across the border. The demographics in Mexico and the increased border enforcement have greatly reduced the supply of labor. We no longer have carloads of guys driving up to the barn asking for work. A lot of those people that used to come were from rural backgrounds, milked their dad's cows by hand, had a lot of cattle sense. That was one of the things that made them such wonderful employees. And they're getting older, and people who work here legally often don't have that cattle background. First of all, non-Hispanics are hard to attract to dairy farm work, and secondly, many of them don't have a lot of cattle experience. So that is a potential problem for us. We have to spend more time on training. And another shortage in the dairy industry is of middle managers, competent middle managers, sort of the sergeants and lieutenants who make things run. And so I'd say overall, I don't see a great deterioration in cattle handling skills, but I think it is something we need to train people to do now, where we normally did not have to in the past, or not to the same extent.
Well, I thought I heard an aspect of your question about farm of origin, and I think that's extremely rare. As these farmer feeder operations have gotten a little bigger in size and scope, we see them down in the Oklahoma City sale barn all the time, buying their cattle there. Eastern Nebraska is full of southeastern calves, so I don't think that happens very often at all. So a lot of cattle are moving into even the smaller operations.
I had a question for Dr. Engler. In your presentation, you indicated that you had seen increased lung lesions in new arrivals, and I was curious how you determined or measured that change.
Well, it's just Carter's impression. But obviously, we post cattle after arrival, soon after arrival, and we'll look at old lesions versus new lesions. But we also know that some of these cattle that we post late in the feeding period will have old lesions in them and maybe not even an active lesion. So it's just an impression. Is that fair, Carter?
Mike, you analyzed your data taking out the Mexican cattle. Off the top of your head, can you tell us the trends in the Mexican origin cattle as compared to the U.S. cattle?
Well, one reason we did that was our packer asked us to de-emphasize Mexican, so we were out of the Mexican market for several years. So it didn't look like we could connect the dots. So we took them out of the deal, but our Mexican cattle still do remarkably well in the feed yards. I don't know if that answered your question. We haven't seen any overall trend.
Thanks again to all the speakers. It was a really great kickoff session this morning. I was intrigued that at least a couple of you mentioned the concept that maybe rapid growth was associated with increased risk for BRD. And I would love to hear you just expand on that a little bit if you can, maybe. And I'd also was wondering, Dr. Dargitz, if you have been able to pick up any support for that in the NOMS data, or if that's even possible. So any of the speakers, I'd be interested to hear what you think.
I think the short answer from the NOMS data is no. I don't think we have any real window into being able to look at that.
I'll hand it back to Walt, but I'm intrigued with this hypothesis.
It is a hypothesis, but it's based on there's some studies at Colorado, I'm sure many of you are more familiar with than I am, on pulmonary hypertension and lung clearance at high altitudes. And I'm intrigued by what Sam slides on, that the lung is the rate limiting, that's his opinion, the rate limiting organ in growing in cattle. And I'm puzzled, as I said, by the fact that as we improve the nutrition of weaned calves, we don't see a decrease in respiratory disease, which is one of the things we were hoping for, that if we wean a stronger, healthier, fatter calf, that we'd have less trouble after weaning. That has not proven out. And one point I forgot to make is that the big inflection point on those survival curves was around 25 to 27 to 29 days. So it's happening at the beginning of the second month in the hutch. And so it's really just a hypothesis, but cattle, the lung is their weak organ, so maybe there's something to it, but it's strictly an idea of mine at this point. Not of mine, but an intriguing idea.
With the current method of moving cattle from small cow-calf farms in the southeast to feedlots, I remember several years ago listening to talks on increasing integration, where there was a growing attempt to reduce the number of stops cattle made along the way, and I don't know, is there been any progress made in that to reduce the number of commingling stops of these calves from farm of origin to feedlot?
There certainly are attempts. Friona Industries, one of our competitors in Amarillo, has spent a lot of effort on putting together a supply chain, so to speak, preferred suppliers, more country cattle, etc. We've tried to emulate them as best we can. They got there first and got all the good guys lined up. But we've found that buying more country cattle, staying out of the sale barns, certainly helps a lot. There is a confounding issue, though, and one of the reasons we emphasized that was we're doing more sorting. These animals are worth so much money, and all the pounds are worth so much money. We try to get every animal to its optimal end point. So the negative to our operation, even if we try to buy more single-source, single-branded cattle from the country, is we're doing more commingling at the feed yard on arrival sorts, and then and probably causing as much problem as we're trying to solve with. But we feel that that's our economic opportunity, is to get them into better, more homogeneous outcome groups.
As far as I know, in the western dairy beef market, cattle move directly from the calf raiser to the feedlot. I don't think many go through a sale barn. There is a big, I shouldn't say that, there is a big steer sale in Tulare every month, but I'd say most seem to move even if they're bought at that video auction, they go directly from the calf ranch to the feedlot. They don't go through an actual physical sale barn. I'm not sure what happens in the east where the farms are smaller.
Well, maybe if maybe the speakers will stay up a little bit, but Dr. Fry taught me that caffeine blocks ADH, and looking at the gray hair, no hair, Dr. Cash taught me that prostates get larger. If we're going to get started by 10 o'clock, we probably better take our break. So
we'll go ahead and take a 15-minute break, though. So we're going to start up again at 10 after 10. Okay, so 15 minutes.